By the time Santos Ruiz heard from the prison doctor last July, his father had been at St. Francis Memorial Hospital in San Francisco for 2 weeks and on a ventilator.
"We don't think he's going to make it," he recalled her saying.
This was the first time Ruiz had heard that his father, a 61-year-old inmate at San Quentin State Prison, even had the virus. "It wasn't right," Ruiz said. "They waited to a point where a person can't talk, a person can't communicate with his family that loved him." As the pandemic has ravaged California prisons, some families say that officials have failed to inform them when their loved ones have been hospitalized with the virus, receiving a call only when it might already be too late to say their goodbyes, act as surrogate decision makers or provide critical emotional support. State law requires the California Department of Corrections and Rehabilitation to use all reasonable means to notify an inmate's designated contacts in the case of a death, serious illness or serious injury.
The law does not say when exactly the prison must alert families. The CDCR's operations manual says, as soon as possible, or what's deemed a serious illness.
In a statement, prison system officials said they have worked with hospitals to facilitate video calls between incarcerated patients and families, noting that they understand the desire for friends and family to stay informed of their loved one's healthcare status, particularly during the COVID-19 pandemic. When asked to address claims that families are not notified promptly of hospitalizations and that coronavirus-related hospitalizations should be indicative of a serious illness, the CDCR and the California Correctional Health Care Services Agency pointed to state notification policy and said they could not comment on specific cases because of medical privacy laws. "I know it's hard to understand, but not hearing from the institution is a good thing," a prison official wrote in an email to Jennifer Chacon of Corona, who said her husband, an inmate at Kern Valley State Prison, battled the coronavirus at an outside hospital for weeks without her knowing. Prison advocates, who have long argued that a hospitalization should trigger an emergency notification, say the issue has come up often during the pandemic. They point to how COVID-19 has killed more than 500,000 people nationwide. Across California, 211 prisoners have died. There's a fundamental human dignity to allow someone to communicate with their loved ones when they know they're dying, said Michael Bien, a leading Bay Area attorney for prison mental health issues.
Health experts also say that contact with loved ones might help patients.
Dr. Marwa Kalani, director of palliative care at Providence Holy Cross Medical Center in Mission Hills, said doctors should not just give patients medication and hope for the best.